My name's Linda Keefe. I'm a nurse and program coordinator with the Needle Exchange program in Prince George, and I've been with this program for 20 years. I work with a more unique kind of group of people. It's a bit different than sort of mainstream people. So most of the people that I work with are trying to cope with mental health and addictions issues. So they don't usually go and seek out treatment right away. I would say more commonly what we would see is people embarking on anywhere from a 6 month to 2 years increase in their substance use, because for most of the people that we're working with, they have long histories of personal trauma in their lives, where substance use is the only way, only mechanism for pain management that they've ever learned. It's how they cope with trauma, and that is their response to this particular trauma. So there have been a few people, particularly who've been diagnosed much later in the AIDS stage, who don't have time to do that, who actually clean up with an HIV diagnosis and make profound life changes. But I would say the majority tend to go on a real heavy drug and alcohol run before you see them sort of pop their head up again, and usually they're stopping that run because there's some other kind of trauma or crisis that's happened. And that's an opportunity for us as healthcare providers then to initiate some discussion around change. I think that what is more of an issue than the client understanding or not understanding the importance of staying with a regular regime is that for our particular clients, they're so enmeshed in their substance abuse and their lives are so chaotic, and often their housing situation is compromised. They may be living in shelters, that to even look at being on a regime, that required daily or several times a day medication would be out of the question. So it is why with this new medication adherence program and being able to support people, assist them in finding housing and stabilizing in those kinds of basic needs, I could see that we'll make a lot more headway.